Hi friends, I am Dr. Anil Bhoraskar. I am a diabetologist attached to Raheja Hospital, Fortis. I am a secretary of Diabetic Association of India Scientific Section. I was the chair of Southeast Asia International Diabetic Federation till 2018, and I am involved in the diabetes care for the last 35 years working in Raheja Hospital. As you know, our main objective of this program is to understand the impact of diabetes on the family members, how it affects the family members, how it affects the family life, how it affects the family atmosphere and dining table. And that is an important aspect, and we need to train the family members to take a role of a great supportive structure. What diabetic needs is a support structure, both from the hospital institutions and the most important from the spouse and the family members. And this particularly happens when a diabetic has to follow a very rigid diet written by the dietitians and insisted by the diabetologists, and then they take it to the kitchen. It creates a lot of problems, particularly when they are eating together. A diabetic food need not be different from the rest of the family members. This is one mistake people do, that they give a specialized diet by which the person is completely alienated from the rest of the family members. In fact, the other family members also feel a big burden that, look, my father cannot eat mangoes, my father cannot intake any mithai. So there is no festivity, we have to observe restrictions ourselves. So this has to be taught to the family members, that quite a wisdom would probably prevail on them, that is, this diet that we write to the diabetic patient is also a healthy diet for the rest of the family members, even if they are not diabetics. If they follow a general pathway of a reasonable, good diet, they will not get diabetes. This also has to be told to them. But many times, the timing of meals, the timing of insulin, the timing of taking tablets, the exercise schedule needs to be regimental in quite a few diabetic. That disturbs the family life. That makes the family slightly stressed, that they need to adhere to timing of the father's insulin as well as the meal timing, and they cannot keep a delay in dinner, or they cannot have big parties at home. All this, if you take a very, very balanced view, can be overcome, and most of the families who are taught well as how to cope up with this live very happily. They don't think a diabetic is a burden. They don't think diabetes is a big headache for them, and they don't shun him. In fact, it becomes a more lovable part of the family. Everybody cares for him. Nobody wants to shower care on him, but they have to make him feel that he is a normal person. The whole objective of treating diabetes is to make a person feel that he is like other normal human beings and not a very special person, and that's a major role by the family. Similarly, in these days, when the supplies and the investigation and the doctor's treatment is quite expensive, so this is a burden on the family members. I know, for example, one person who had to undergo a bypass surgery, and the budget which was allocated for a beautiful trip to Switzerland, the family had to sacrifice that and spend that money on this patient's bypass surgery. So these events do happen. At that time, if the whole family take a very balanced view and take a supportive rule, look, doesn't matter, this time we have missed the vacation, we'll do it next time, but the life of my father or mother is very important, and that's why they prioritize the expenditure in a very judicial manner, and that needs a lot of training. Some of them need a bit of sacrifice. Family members also have to learn to sacrifice certain things. At the same time, they should be prepared for certain amount of irritability with a patient who's to have little mental stress and depression. The family must know how to deal with it, should not get affected. And that's the way we teach our patients' families as how to cope up with this disease, which is a chronic disease. It's a long-term disease. People live with this disease for 25, 30 years. And therefore, it's not a short-lived illness. And therefore, there is a way of life in a particular family. And I got my patients whose families are very happy and they come here, they accompany their father or mother, and they have full understanding of serious emergencies, and they can give remedies like hypoglycemia can be treated at home. If the patient has got some wound infection, the dressings can be done by family members. The emergency bells, they can immediately bring the patient who may not have classical symptom but straight to emergency room, because they are taught so much about diabetes that they can take steps and even save life of a diabetic patient. So my friends, I think a family training is as important as training a diabetic patient. Thank you very much.